This sign indicates thyroid cancer. 500 million people worldwide are diagnosed with thyroid cancer annually. You likely know someone close who's had this diagnosis, as it's becoming increasingly common. In this video, I'll discuss 7 warning signs you should be concerned about. It's a common question. Should I worry? The answer is yes. If you have any of these signs, you should be concerned and seek medical help to check for thyroid cancer. Now, you heard me say it's increasing a lot, right? There are 2 reasons for this. What are these 2 reasons? First, diagnosis is easier now with more diagnostic tools available. Now, in virtually any city worldwide, you can access thyroid ultrasounds, Connecticut scans, and other tests to evaluate the thyroid gland. These exams are more readily available than ever. This means diagnoses can be made more frequently and in greater numbers. Secondly, thyroid cancer is linked to factors like obesity and a lifestyle that includes many ultra-processed foods. This diet and obesity have been specifically associated with an increased risk of thyroid cancer. Not just thyroid cancer, but obesity is linked to other cancers too, like breast, liver, prostate, and colon cancer. So it's not unique to thyroid cancer. But this lifestyle leading to obesity and high consumption of ultra-processed foods increases cancer risk overall. So, with improved diagnostic tools, we're seeing a significant increase in thyroid cancer cases. In this video, I'll discuss signs, symptoms, and address a common question you ask about diet. What's the right diet for thyroid health? Does such a diet exist? Are there helpful supplements? Does iodine supplementation make sense? After explaining signs and symptoms, I'll address myths, diet, and thyroid-specific supplements. As an endocrinologist specializing in thyroid, I'll stick to scientific evidence. Let's look at the signs and symptoms. There are 7. The first and most common sign of thyroid cancer is a thyroid nodule. But let me explain this further. Often, thyroid cancer develops from a thyroid nodule. Not all nodules become cancerous, though. In fact, the vast majority, 90 to 95% of thyroid nodules are benign and will never cause problems. So why am I mentioning this? Because these nodules have certain traits we consider when deciding if they need investigation for potential thyroid cancer. What are these thyroid cancer characteristics? First, a nodule that's growing in size. That's a red flag. It needs investigation. Nodules with microcalcifications or irregular borders. Ultrasound can reveal these characteristics. A darker or hypoechoic nodule, as we say in medical terms, is solid. We know thyroid cysts have a much lower cancer risk. So, a solid nodule is another factor to consider. A nodule taller than wide or a single nodule is concerning. Many think multiple nodules mean higher cancer risk, but that's not true. The answer is no. A single nodule actually has a higher chance of being cancerous than multiple nodules. That information surprised you, didn't it? It's often misunderstood the other way around. I often see worried patients saying, I have many nodules, so I must have cancer. But for thyroid cancer, a solitary nodule actually has a slightly higher risk than multiple nodules. If the nodule has central blood flow, asymmetric growth, or features I mentioned, it needs investigation. When discussing thyroid nodules, you'll often see THYROIDs in the results. Have you heard of it or read about it? It's a common topic in medical consultations. What is it? A convention was held to standardize thyroid nodule management. Why? Many doctors had different approaches to the same nodule. This convention aimed to unify and guide medical practices. It's not perfect and has some flaws. I won't detail it here, but this classification can guide treatment. If this nodule needs investigation, they'll do a fine needle aspiration, FNA, or follow-up depending on the case. I'll highlight the nodule here, the first sign of cancer with these characteristics. The second sign of thyroid cancer, easier to spot but often ignored, are the lymph nodes in the neck. These are the enlarged nodes. You've probably noticed these neck lumps get bigger when you have a cold or flu. Lymph nodes are part of our immune system. But if these lumps are growing without infection, staying large, and aren't linked to any illness, it could be thyroid cancer. So, it's a warning sign to check out the thyroid area. The third sign is pain in the neck around the thyroid. Often when I do a thyroid exam, Many patients report pain. Well, that's not normal. Pain when looking sideways, lying down, or with specific movements, okay, the neck area, the thyroid shouldn't hurt. During palpation with the doctor's hand on the neck, some sensitivity is normal. That's okay. But pain shouldn't happen, got it? Sometimes I palpate and the patient winces. Ouch, that hurts. We'll investigate, often finding thyroid changes, all right? So you shouldn't be feeling pain. This sign is often overlooked, like the lymph nodes I mentioned. The fourth sign is difficulty swallowing. Why? As the nodule grows, it can compress the esophagus, affecting food passage from mouth to stomach. This compression can cause difficulty swallowing. In thyroid cancer, swallowing issues start with solid foods and progress to liquids if untreated. Neurological swallowing problems begin with liquids and progress to solids, okay? This difference helps doctors determine which investigation to start. Thyroid issues begin with solids. Sign 5 is shortness of breath, as the nodule may compress the trachea, affecting airflow to lungs. This can manifest as breathing difficulties. This sign often occurs in more advanced stages. Remember, common thyroid cancers like papillary and follicular type have good prognoses even in advanced stages. So if you're experiencing this, don't think it's too late. Treatment exists and patients often manage the disease well. Even in late stages, unlike tougher cancers like pancreatic, thyroid cancer is more manageable. Thyroid cancer has this unique trait of responding well to treatment. I'll discuss this more, but let's continue with the video. Sign number 6 is hoarseness. Why? As thyroid cancer grows, it can affect the recurrent laryngeal nerve, causing hoarseness. In my experience, this is quite common. Often people attribute hoarseness to various reasons. Oh, I screamed too much. I had a presentation. I talked a lot. I was singing. I caught a cold. The thyroid often gets overlooked, pushed to the background. Hoarseness is indeed a major red flag, as it can indicate nerve involvement. The cancer doesn't necessarily grow in the vocal cords, but it can affect the nearby nerve. The seventh and final sign, often overlooked in thyroid issues, is coughing. Studies show that thyroid cancer patients often experience increased coughing frequency. Not all patients have this, but it's crucial to connect the dots. If a patient has several of these signs and a growing nodule, it's concerning. So, these are the factors to consider during evaluation. How is this evaluation done? Later, I'll discuss the most asked question, diet and thyroid. For a thyroid nodule or suspected cancer, a hormone evaluation is mandatory. At least 2 tests are needed, free T4 to check hormone production, and TSH, the thyroid stimulating hormone. These tests help us determine if it's a hormone-producing nodule or not. If the nodule is producing hormones, is that good or bad? The answer is, it's good. Many people panic. Oh no, my nodule is producing hormones. However, this is actually a sign of benignity. It's less likely to be cancer when a nodule produces hormones. So if this is your case, don't worry too. You should still investigate, of course, but it's a positive sign. It's much harder for a hot nodule, as we call it, that produces hormones to become or be treated as cancer. So that's the first thing. A hormonal evaluation is mandatory. I often see this overlooked in clinical practice. Some patients are even referred with other tests, but the nodule's hormonal function wasn't evaluated. Then we assess the image via ultrasound, which is usually the go-to exam, right? It's safe for patients, widely available, and with blood tests, doctors can decide if a fine needle aspiration is needed. If done, this procedure provides a classification called the Bethesda classification. Have you heard of it? It's often misunderstood. The Bethesda scale ranges from 1 to 6, indicating cancer likelihood. It doesn't confirm cancer, understand? It's not a full biopsy, just an estimate. Sometimes high-risk results turn out not to be cancer, so it's not definitive. Conversely, low-risk results can sometimes be cancer. So just like I mentioned THYROIDs, Bethesda is also a classification system to guide, not to give a definitive diagnosis. Based on this result and other tests, if a nodule has a high cancer risk, the patient is referred for a biopsy. This is often done during surgery, which is typically the chosen treatment. Only then can the doctor confirm the diagnosis, okay? So there's no point in panicking prematurely. As an endocrinologist, I often calm patients, explain treatment options, and clarify which stage we're at, all right? Now, What's the role of diet and the thyroid? Are there any supplements? Have you heard of Lugol's iodine? In some parts of the world, it's extremely popular. Let's discuss this. For the thyroid to produce hormones and function properly, you need nutrients like selenium, zinc, and iron. These are crucial for hormone production. However, if you have a reasonably balanced diet, you can get these nutrients through your food. There's no specific thyroid supplement, despite what many sellers claim, promising to activate your thyroid. That's all nonsense, okay? No supplement will activate your thyroid, but you do need a balanced diet, preferably with natural foods, avoiding ultra-processed ones. So what foods will give you these nutrients I mentioned? Nuts, for example. Cashews, Brazil nuts, and even peanuts contain significant amounts of these nutrients. Other foods like berries, citrus fruits, avocado, red meat, seafood, shrimp, and fish are also healthy for the thyroid. Dark leafy greens with copper, zinc, and magnesium are also good for thyroid function. Broccoli, cauliflower, Brussels sprouts. Now you might be thinking, but I heard broccoli was bad for the thyroid. The answer is no, it's not harmful, okay? It doesn't cause hormonal issues or thyroid cancer. You can definitely eat broccoli. This idea came from a study on rodents. Yes, you're not a rodent, are you? The study was done on rodents that only ate broccoli. These rodents developed goiter, an enlarged thyroid with hormonal problems. However, this doesn't happen in humans. So, no need to worry. You can eat these veggies and other foods I mentioned, like eggs, both the white and the yolk, chia seeds, flax seeds, dairy products, and Greek yogurt, which I really enjoy. Leaner cheeses are also healthy for thyroid function. Got it? There's no such thing as a supplement or substance to activate the thyroid. That's all lies and quackery. On a scale of 0 to 10, how would you rate this video? If it's a 10, I'll make more videos like this. Now I'll leave a suggestion for you to watch. It's a video where I discuss signs and symptoms of diabetes at night. Did you know your body can show specific signs when blood sugar is high? Not necessarily very high, but even slightly elevated levels can cause symptoms. I also share tips to help control this during nighttime. If you click here, you'll be directed to this video about diabetes. Take care. See you next time.